Hello, everybody. Welcome to Q&A with A&V. I am Vincent Racaniello, and joining me tonight from New York, Amy Rosenfeld.
Hello, Vincent. How are you today?
I've talked to you for about 3 hours today. You already know, right?
3 hours. Only 3 hours?
We spent 2 hours on the IRB protocol, right?
Oh, yeah. I like to black those out. But I'm not good at those.
Anyway, thanks,
I
folks.
don't like to black it out.
Thanks,
How
folks,
many thumbs
for...
down did we start off with? 5, 6,
No,
10,
we
20?
don't have any yet, but if you say it, people will give it. We are appreciative that you changed nights for us, but it won't happen again, hopefully. In the past week, I've received some interesting gifts. 2 gifts I want to show you, okay, from 2 people who are on this stream. The first one is from Eric.
I got a gift?
No, they're for the studio. I don't know if you can see this. Yeah, you can. Well,
Wait, you're too close. You got to move back. Move back. Move back. Ah, it's your favorite virus, not mine. But it's a lovely polio with all the VPs. I like that.
So that's lovely. A painting. He painted it from the structure.
How come you can't paint EV68? That's the more important virus.
All right, so that's cool. Thank you, Eric.
That's very cool.
This can go behind the conference table in the what do you call it? The incubator.
Yeah.
And I got a packet from the artist Susan Black Culleton.
Who?
Which here we go. For the beautiful white walls in the incubator. Okay. Notice the spelling. A huge thank you for 7 years of education, entertainment, and remote camaraderie.
That's
Happy
great.
studio warming. So look at her stickers. She has
they're periodic table stickers.
Okay. So included in this packet are stickers. You can see antibodies right there.
I see.
There's a bacteriophage. I won't take those out, but let me take out these print. She does marvelous work, by the way. Look at this, for example. These are plasmids. How do I get?
I can't see. Oh,
plasmids.
Wow.
All different open reading frames, right?
Cool.
Escherichia coli.
I was going to say our favorite bacteria.
These are all watercolors.
That's
mixed
great.
Culture.
What is that? Oh, mixed
It's a
culture?
mixed culture of bacteria, penicillium.
Good.
Isn't that beautiful? That watercolors. I kind of like the plasmids, right?
Yeah, but everybody has ignored the most important virus out there.
I know, enterovirus D68.
Yes. It's the most important. It's the most important entity. I just don't understand.
Anyway, we have it in up close and personal. There we go. First dislike, Amy. Yay!
Excellent. Very good.
We have it up close and personal tonight. A little cropped view. We thought we might try. So let's do that. And let me remind you, folks, if you want to ask us a question as opposed to chatting amongst yourselves, which is always cool, you put at Amy or at Vincent in front of the question. That way we know it's for us, right?
Yep.
So we have Vanity tonight, Vanity Nutrition Modding. Is Frank here?
Great.
Yes, Frank. Hello, Frank. Welcome to you both, and thank you ahead of time for modding. Vanity is 5 miles up in the air again.
Oh, she's a big flyer.
Yes, that's her job.
Oh, she's a stewardess?
Well, that's not the word we use anymore. Flight attendant.
Flight attendant. Okay.
Okay, let's hit some questions. Here, see, that's the way to do it. Vincent and Amy, are there studies of the effects of circadian state on the efficacy of COVID vaccine?
I don't believe so. The idea of medicines, responses to medicines or therapeutics being regulated by the circadian rhythms of your body is rather new. And very few good studies have been done on anything like that.
Doesn't someone in our building work on that in flies?
Mimi works on circadian rhythms. And she works on she gave a talk in Chicago once when I was there about oncotherapy, I think chemotherapy, and how it works better at night or something. And then she followed it up with something about Rod's comment. I forget exactly.
You like the up-close display tonight? Okay, good. I'm sure some will hate it, some will like it. That's the way everything goes in the world. Oh, I see someone, Peter J.D. We went to Northern Highlands Regional High School. Peter, I hardly meet anyone from high school. I don't know why.
Why, that's in Upper Saddle River?
Allendale, New Jersey. We had a regional high school with the neighboring town.
How is that regional then? It's just you and the neighboring town.
Well, it's called a regional high school. If you have two towns, it's regional, no? My mother taught there, too. All right.
I don't know. I would have thought two towns was two towns and regional was more than two towns.
No, I think it's more than one. Yeah, well, anyway, are there any
Okay,
documented
well,
cases of
whatever.
breakthrough leading to super spreading? Could vaccines reduce severe transmission the same way they reduce severe disease? Are you aware, Amy, of any super spreaders arising from people who are vaccinated and get infected?
Wouldn't that be the paper that we discussed that I didn't like? That you claim that Condit said showed that vaccinees transmit, and then when we read the abstract, it was really unclear if vaccinees were really transmitting or not.
Yeah, well, I don't know if that qualifies. Was that a super spreader event? I guess so. Was that a camp, right?
I don't know what qualifies as a super spreader event. What's a super spreader? More than two? More than one? More than five? What's a super spreader? More than 100?
The epidemiologists say, I know one when I see it.
Really? Because I know a bullshitter when I see it, and that would
More
be
than
it.
a few. More than a few.
More than a few. Well, define a few. My mother has a few kids. She has two.
If it was a couple, two, three. Couple,
Yeah,
two, three.
Exactly.
Let's make a definition. Well, we could look it up.
Kids.
We could look it up. What is a super spreader event? So let's see how many they say. A disproportionately high number of people.
Again, my mother has a few kids. She has 3 daughters. You know?
Yeah. Well, you know,
her mother had a few kids, or her
anyway,
mother is one of a few kids. She's of 5 children. Like
anyway, I think it's a good question, Lamont. And we'll see. We don't have enough data yet, but that's a good thing to keep an eye on, I think.
It's just crazy.
The comment sections at TWIV 802 half-jokingly suggested crowdfunding a good headset. Yeah, he doesn't have great sound. I'm sorry. I used to send headsets to my guests, but I had a guest every 6 months, so it was no big deal, and I would say keep it. But yeah, he'd probably be back, so I should send him one. Yeah.
Why would he keep coming back?
He likes to be on TWIV because he gets an hour to talk, and he doesn't always get an hour to talk, right? Except maybe on a few other pods.
What podcast has he been on besides Google Sync, which is not a podcast?
There's one with the guy from San Diego, UCSD.
Stan Malloy has a podcast?
No. MedCram. He was on that. Isn't that a long pod? Maybe not. I don't know. I don't listen to too many pods. I just make them.
What are you talking about? You listen to pods all the time. They just don't happen to be science podcasts.
I want to ask you 3 questions. And are the RT-PCR product need bioinformatic data of every variant to make them effectively? Do you need to do bioinformatics but on the sequences? That's the question, I think, Amy.
To do what?
To show that they're SARS-CoV-2 if they're a variant.
No.
How do you know? What do you do?
You can have primer pairs that only prime off of the variant, or you can do a TACMAN assay where you have a probe in between, and when it's not a variant, when it is a variant, the probe doesn't bind as well, and so as the polymerase chugs along, it pushes the probe off, and the probe fluoresces. It's the same idea as making TACMAN for diagnosing HIV cases in the clades. And I suggested this, I don't know. I would say I talked to Daniel about this in February of 2020.
Mm-hmm.
We've seen how successful that has worked out.
All right. Now, question 2, how to avoid cytokine storm? Cytokines with a C.
Cytokines with a C? Well, it's okay. You can have a misspelling.
I don't think you can avoid it, right?
No, there's not unless you avoid getting infected. Maybe that's the question: is how do you avoid getting infected? And that's getting vaccinated and wearing a mask.
I guess you could take a immunosuppressant, but you'd really need to know what was causing the storm. So I don't think you
What
can avoid it. That's right.
immunosuppressant are you going to take? Rapamycin, which is a translation inhibitor that reduces everything. What are you going to take?
Or if you knew that it was starting with, say, IL-6, you could take an inhibitor, but we don't often know that. So, no, there's nothing you can do, Joseph. Sorry. I think that's number 2. Let's see.
I don't know.
Number
I would have
3.
said don't get infected, wear a mask, and get vaccinated.
Wear a mask and get vaccinated. Okay. Whenever COVID news gets me down, stressed, I find relief by listening to TWIV. I find your educated voices quite soothing. Thank you very much. Can viruses still mutate in vaccinated people? Melbourne.
Yes. Yes.
Sure, you bet.
Called polio.
As long as they reproduce, they can mutate.
It's called polio.
My hiking buddy said Amy is cool.
It's cute.
Yeah, are you cool?
I am very cool. Yes. I know it. Yes, everybody seems to say I'm very cool. So I can't judge myself, so I can only repeat what others tell me. But yes, apparently I'm cool.
Oh, this is a great question. If Amy had Rachel Walensky's job, how would the pandemic in the U.S. be different? What a great question.
Can we say not a shit show?
Yeah, you could say that. Yeah. Amy often comes in and tells me, look at what the lady did today.
What are you talking about? It's not just the lady.
I think it would be less confusing
For sure.
More science-based. Because after all, Amy is...
Not science-based at all.
Not at all.
Not now and not ever. But it would definitely be less confusing. I really don't think that this has been I don't think changing of administrations has resulted in exactly what it needed to do 100%. I think you needed to have one concrete sound voice. And I think that voice needed to get a lot of input from different virologists and scientists, and then really think prudently before they release statements, because they needed to account for the fact that in this day and age, you're not allowed to walk things back. You cannot come out and say, unless you really come out and very clearly say, I made a mistake. And nobody does that but you and me. And some of it is just logic. Like, the idea that kids don't get infected was just ridiculous. The idea that kids don't transmit was equally as ridiculous. And the idea that we're still only giving monoclonals to people who are in high risk groups is equally ridiculous. And that, so I talked to Daniel. Did you know this? That really there's no trial, or there is only a trial now beginning that talks about using monoclonals to kids under the age of 12 who cannot get vaccinated.
No,
Why?
That's crazy.
Yeah, that's 20 months into a pandemic, and these children under 12 who have no ability to get vaccinated, even if they wanted to, have no now recourse about treatment. Like, that's ridiculous.
Agreed. Daniel talked about that a bit today. Oh, by the
Yeah,
way,
that's because I asked him on Sunday. What? Sorry.
The decision on boosters is going to be made tomorrow by the FDA, right?
Oh, really?
That's what Daniel said, yes.
And is the Philip Krause participating in this? Did you email him?
It did, but he never answered.
Well, you have to email every day.
I want to bug him.
Yes.
Amy, any thoughts on the Nicki Minaj story? I have no idea what this is.
I just finished telling you about
it. Tell Elena. She wants to know, and I can't tell her.
Okay, so Nicki Minaj is a rapper. She's, I don't know, in her late 20s, early 30s, whatever. She was invited to the Met Gala, which I love to watch because it's just crazy fashion walking up Fifth Avenue. It's fantastic. And she refused, she couldn't go because you had to be vaccinated and she wasn't vaccinated. And she came out and she made a tweet that said that her cousin in Trinidad and Tobago had been vaccinated and was sterilized by the vaccine. And the health minister of Trinidad and Tobago came out and said that's flat out wrong. Not true, totally false. So the Biden administration said, well, we'll have a call. We invite Nicki Minaj to have a call with the doctors of the White House and discuss her concerns and, making sure that she's now educated appropriately, where she knows that the vaccines have been tested and they're safe and there's none of this ridiculousness. So she thought she was going to the White House. So she got all dressed up as some fancy character who I can't remember, was like very famous. And, they're just speaking to her, I guess, instead, and trying to set the record straight. But, she has this big following because she's a rap star and she sings, controversial songs like Wet Pussy or something or other. And now she has this tweet that falls out and says, vaccines are sterilizing, don't get vaccinated, or I need more information.
Yeah,
and
not good.
It's just, it's like, we've already discussed this. Were you not paying attention 6 months ago?
Nope. Okay, there you have it from someone who would know. If someone reconstructed variola virus and intentionally released it, how bad could it get? Do you think we could eradicate it again? Well,
if you're going to complain about spelling, eradicated is spelled wrong.
With an E. One E, and one R.
One R.
Only one R. But so we have a stockpile now of 2 smallpox antivirals and a vaccine, enough to get every American immunized or treated. So I think we would respond very quickly and stop it. In 1946, a man walked into New York City with smallpox, and they immediately immunized millions of people and stopped the spread. So today, I think we could do it. Yeah.
Good luck.
All right, here's a hardcore immunology question. Does B-cell maturation happen only in the draining lymph node for the injection site, or do B-cells mature in all the lymph nodes after migrating there? I just don't know, but I would think they could migrate. They'd be probably mostly in the draining lymph nodes, but they could migrate anywhere. What do you think? I don't know the answer, though.
I think that they go everywhere.
Yeah.
I don't think it's in the draining lymph node at all. I think they go everywhere.
Okay. Do you know of any studies that followed around masked people and unmasked people over the course of a couple of months? Oh, Daniel just talked about a study similar to this, and it's going to be in Saturday's clinical report from Daniel. So check it out. It's a similar study where they looked at infection rates masked versus unmasked in a community where you could easily identify both of them. Yeah, it is a straightforward study, and I think the results look good. All right, even though this one doesn't have a Vincent or Amy in front, it's an important question. Can you explain why, if the Delta spike is different, why are they saying it's better to have gotten the vaccine? Why would the vaccine have any relevance to Delta? They want to take a stab at that spike question, Amy?
Well, so it's got a few changes. They don't change what the T cells recognize, and they don't significantly totally abrogate the antibodies recognizing it. They make it so the antibody is recognized a little bit less efficiently. So why would the vaccine have any relevance to Delta? Is the vaccine causes an immune response, and then if you wait long enough, the appropriate window of time, you automatically get somatic hypermutation and an affinity maturation, and just by random chance you generate an antibody that will recognize the Delta spike. It's not, oh my god, the immune system made an antibody for Delta. No, it just randomly occurs by chance.
We should point out, Kathleen, the vaccine's relevant because the vaccines prevent severe disease and death caused by Delta and any other variant. So it works against them.
And the truth of the matter is that except for one paper that I sent you earlier this week, there has never been a study that suggested that the T cell epitopes are changing. And when you get re-exposed after vaccination, it's the T cells that come and respond first. It's actually, vaccine is not for antibodies. It's for T cells, which then stimulate the antibodies. It's unfortunate.
Aiden, I'm saying my son's name. Australia, does adaptive immunity nullify innate immune response to a specific threat, and could prophylactic vaccines exposed to high infectious pressure increase potential for variants in ADE? Thanks. Thank you for your super chat, Aiden.
No, it doesn't nullify innate immune responses. Why would it?
Yeah.
It doesn't. I guess if you thought, increased pressure selection. Maybe it influences selection. But there is no ADE. We should stop talking about ADE. It's, again, ridiculous. And people who think that there's ADE, they should listen to their Republican people who have been infected after the vaccine, like Lindsey Graham and Mitch McConnell and various other people who come out and say, oh, I got infected after the vaccine and I had very mild symptoms. And if I didn't have the vaccine, I would be dead by now. Hey, that demonstrates no ADE. It does.
Agreed. All right. Is it possible to explain the furin cleavage site to a layperson? Whenever it is mentioned on Twiv, it sends me into a comprehension black hole.
Go ahead.
Think of a pair of scissors cutting a string. The string is the spike protein. Where the scissors cut, they cut very specific places, and the furin site is one of those. And the scissors is called furin. It's an enzyme, and it cut. Wait a minute, let me finish. And it cuts the string, and cutting it there is apparently required for efficient entry of the virus into the cell. What were you going to say, Amy?
Nothing.
I'm sorry if we send you into a black hole. We should explain more than we do, but then we would never get past the first figure, I think. Maybe that's for another podcast where we go through things very slowly. Maybe it's a live stream where we say, okay, here's this figure and here's how the experiment works, and people can bombard us with questions. That could be fun. From the incubator. Okay, Matthew says, had 2 Sinopharm shots, Pfizer booster, got tinnitus day after booster, need another Pfizer to get vaccine pass now. I live in the EU. Thoughts? I want to skip it, but it's annoying. You're afraid you're going to get more tinnitus, right? A lot of people see that after vaccination. What would you recommend, Amy? Ringing in the ear, right?
Yeah, I'm trying to figure out why you would get ringing in the ear from a vaccine.
It's one of the reported side effects.
Yeah, well, so is car accidents.
No, it's not a side effect of the vaccine. It can happen when you get vaccinated. But this is a side effect.
Then it goes away.
It goes away. So I think, Matthew,
if you want to get this EU pass and you want to go, and these are the rules, I would just get the booster, I don't know, however. So let's say you go and you get boosted in 3 months to get the pass. Fine, perfect. It's like 1 day of tinnitus.
Yeah, I think you should do that.
1 day of arm soreness.
How is the peer review process done? Do the reviewers replicate any experiments that were conducted?
No.
No, they don't. They just read it and make comments. They can't do that. They would, because they have their own experiments to do. So they read it and try and delay your publication if they're your competitors. I'm not going to ask Amy if that's correct. It's just, so for a journal...
Yeah, don't ask me, because
the journal,
you opened your door and it wouldn't be good.
you send in your manuscript, the journal sends it to 2 or 3 reviewers. They have a couple of weeks to look at it, make comments, critique the experiments, the way it's set up and so forth. And then you may have to go back and do more experiments. And eventually they say, okay, it's acceptable. It's a long, drawn-out process. And it's extremely stressful because this is how you make your livelihood. You publish papers so that you can get grants funded to do research. Although Amy would say you publish papers to disseminate the knowledge. And that's totally true. That's the pure view. But in fact, if you just disseminate and don't get grants, you're not going to disseminate for very long, right?
That is true. That is true. But, I mean, it really is based on the idea of you had a hypothesis and whether or not your experiments and the results of those experiments were appropriate to prove your hypothesis.
Here now, Amy, how do we address this? I trust you guys on science, Dr. Griffin on medicine, Fauci and Walensky on public health. Please don't undermine each other. What do we say to that, Amy?
Well, I'm offended by the idea of undermining each other. So people make mistakes, and when mistakes are not corrected and perpetuated, they become dangerous. And then they become, what was a small mistake becomes a very large mistake and out of control and misinterpreted and then abused, and then people die. So to correct someone is not undermining them. So I'm dismayed at the use of the word, and I'm dismayed that someone does not understand the difference between correcting someone and putting out the right data so nobody gets hurt than to allow continuous false data to continue to hurt people.
That's a good answer. I agree. I don't think we're undermining. We're just being critical, which is what we do in science.
It's not even critical. Critical has a bad connotation.
Okay.
There is the right answer, then there is the wrong answer, and then sometimes it's not always black and white, but there is always the ability to prudently think before answering the question.
How about rigorous? Just being rigorous?
Yeah, sure. That's fine. But critical is not the right word.
Okay. 2 of 805 Youth Camp paper, 18 vaccinated and infected go on to infect 8 close contacts. So Amy pointed out to me that there were unvaccinated people in this camp, and so you can't prove that they didn't get the infection from them and not the vaccinated people. Right, Amy?
Right. So I think it was like 170 people, right? 120, 170, somewhere, something like that, right?
Yep.
And 18 were vaccinated and the rest were unvaccinated. So how you're going to prove that these people shed and gave these other close contacts infection is not quite clear to me, because you're all in the camp. You're all together. So here's an instance of this data could come out. This data is already out. And somebody who is anti-vaxxer or, just in general has a position of contrary to being mainstream. If you say right, they go left. If you say go straight, they go backwards, whatever. You all know that there are people out there who do those kind of things. So here, if I just don't correct or say, well, maybe you shouldn't have written this because it's not really clear how you made the conclusion that the only people that these 8 people have had in contact at this camp of over 100 was 18 vaccinated people, then this person who says, when I say go right, goes left, will come out and say that there's no point in vaccinating. Other people will say, I don't need to get vaccinated. There's no point according to this paper. And that's dangerous, and more people's lives could be lost.
Well put. After watching today's TWIV, so the Delta strain could be more infectious. So what the paper showed in Cells and Culture is that it seems to grow faster. And the authors say, it's more fit, and that could explain why it displaced the previous variant. And they also say it could contribute to increased transmission. And Rich Condit pointed out, remember, it's an infection in a cell culture, and the relevance to humans isn't known. We're going to have to collect more data before we make conclusions.
Well, for sure, cell culture has no immune response or anything. It's one single layer of cells that have been changed.
I think transmission experiments in animals would be useful, but I'm not sure it's the answer because
Really, they weren't useful when Barrick did them for D64G and ferrets or hamsters, and you said you didn't know what they meant, considering the fact that we don't prune each other the same way the animals do.
Yeah, exactly. You remember what I say.
Yeah. And the same thing about the Fouché and whatever the guy from Wisconsin's name is.
Kawaoka.
Kawaoka. When they did their ferret experiments for flu, and all of a sudden it was like, nope, the virus is less virulent. So, not sure that I agree with that.
Where do we stand in regards to blood type in association with severe illness? I haven't heard too much recently.
I think it has been disproven.
That's correct. No association, as far as I know. Upon further examination. Is anyone working on air monitoring devices that can detect virus in the circulating air?
How are you going to detect virus in circulating air? Electric charge?
There are some devices that I've read about, yeah. I don't know their sensitivity and how soon they'll be available and so forth, but I have read some articles about them, but I can't give you details. Okay.
Interesting.
Twiv is on Spotify, yeah. Concerto and B. If you guys want to learn about B cells, man, go back to 161. Gabriel Victora works on them. It's a really good episode. No, Amy's had the same camera for several months, but people like your picture because it's close up, right? Well, a lot of people are saying that, and this man comes for the science, stays for Amy.
It's funny.
Video quality on Amy's improved today because I zoomed in. Maybe we should stay this way.
Okay.
Just wanted to say.
Well, if we do, then we need to change because there's too much distance from the top of my head to the top of the picture.
Well, you could lower the camera.
As I said, we'll have to practice.
Okay, you don't want to do it. You don't want to do it live, right?
Well, if I drop the camera and I break it, you're going to yell at me. So that's more important.
I never yell at you.
Don't, Pinocchio.
It's been a long time since I yelled at you.
Pinocchio.
I just wanted to say keep up the good work. Loved your interview with Lex. Glad you liked it. That was fun to do. Okay. Are there any studies which show that booster shots increase memory T cell effectiveness, or do they only boost antibodies?
I think Shane Crotty has some stuff about T cells.
Yes.
And boosters. And I wouldn't use the word booster. I think second dose, right?
Third dose? Depends on the vaccine, right?
Sure. What vaccine is a third dose?
Well, they want to make a third dose out of Pfizer and Moderna.
Want to make, but actually is authorized as a third dose. I don't know of anyone.
So you don't call it a prime boost for 1-2?
Well, I guess you do.
Yeah, you could.
I don't know. I mean, you wouldn't call it a prime boost for polio. You get 3 within 6 months.
Okay. How many variants would one person hold? Is that like how many viruses on the head of a pin?
Yeah. So you hold as many variants as you have virus. Because the polymerase is 1 error per genome.
Makes a lot of mistakes.
Well, it's actually a really low error rate if you think about it. 1 error per genome is 1 out of every 30,000 bases. If you take that same idea, if you say it's one error per genome for polio, that's one out of every 7,000. That's a much higher mutation rate.
There's a paper we're doing on Tweevo next week, which says that the mutation rate is higher than anticipated. We'll see what it says. I haven't read it yet.
Well, I haven't listened to Tweevo yet.
It's not recorded.
That was the point.
I'm looking forward to seeing the incubator. A little update. I've got a lot of equipment now, and I'm bringing it in slowly and setting it up. I will be ready to stream and record from there by the end of September, so I could do the virology course from there. Next week, maybe I'll do the first pod from the incubator with just a white wall, though. You want those stickers. So here's what we have here.
We're not having any stickers on the wall. No stickers.
No stickers, but I just want to show what she makes. Look at the phage sticker. That's very nice, right?
It's very nice.
And, little DNA.
DNA. Yeah, very good.
What else do we have here? Looks like a coronavirus.
Corona.
And it's shiny. It's very
Maybe
shiny.
it could be like the stickers that were on the ceiling when you were kids and they were like
over your bed.
Stars. Yeah.
You could put an antibody. You could put an antibody on it. And what else? We have another antibody. And it looks like, what do we have here?
I don't know. I can't see.
Oh, it's a Petri dish.
Oh, okay.
With bacteria. These are
Very
stickers.
good.
Very cool. Toys. Anyway, yes, people can visit. People can visit. Okay, if a person tests positive and is asymptomatic, does the adaptive immune system even see it?
Yes.
They do. It does. Because virus is reproducing in you, and that's what it sees. If you could go back in time, what tools, vaccines excluded, would you have ready to go and FDA approved to handle a SARS-CoV-2 outbreak? Well, I'll let Gamey go first, and then I'll go second.
What tools? I would have had a diagnostic that could be readily dispersed and would be very good, and there would be none of this ridiculous crap about viral load and RNA and various other shit. And then from there, I would make a pan antiviral. But you would have to make it a combination therapy. I don't believe in just having one drug because the virus would make resistance, or resistant mutants would be selected for very rapidly.
Yeah.
So yeah, those are my two tools, but I would have put a lot more money and time and effort into making an appropriate diagnostic that could not only be used here, but in Asia and Africa and other developing areas very easily.
So you took diagnostic, and what kind of diagnostic? A lick a stick?
Well, I wouldn't call it a lick-a-stick because lick-a-stick is a ridiculous title. I would call it a very high specific antigen test.
Okay. Do you know the average time to regain taste and smell?
A couple of weeks.
Some people lose it for longer, but maybe that's the average.
I don't
know. J.E. wants to know, Amy, you have a grant application for Lick-a-Stick using nanobodies? Otherwise, how do you achieve low cost? How do you plan to achieve high avidity? How did he know that you have a grant application?
I don't know. I don't know who he is.
But
no, you can't use a nanobody because a nanobody doesn't have anything on the bottom of it. It's just the variable region. So you would have to make it so that there was something that was on the bottom to attach it to the surface. Otherwise, it's very hard to attach nanobodies to the surface.
But you're not working on SARS-CoV-2, right?
No. How otherwise would you? So I would not grow nanobodies or any of this in bacteria because they do not glycosylate. So you need an organism that would glycosylate very efficiently. So if you wanted to be super cheap, I think you can use S2 cells because you can grow them in basically a fermenter. I believe that that is actually what Kramer does, is he grows his stuff in S2 cells.
Insect
Um,
cells. Mm-hmm.
yeah, insect cells. And he gets really, a whopping amount of protein for the volume of the fermenter. And you do that and you plant and you select to achieve high avidity because you've actually selected for the antibody in an animal over time. And it's not just high avidity, you want high affinity too.
All right. U.S. wants to know, once 90% of the population is partially immunized, COVID will still persist with spikes of cases every fall. Is that what you call herd immunity?
Why would there be spikes every fall? Is it every fall? Is that when like there's going to be a significant number of immunologically naive people is only in every fall?
The seasonality of respiratory infections. It's a hypothesis, I think. We don't know, but
Well, I work on a respiratory infection and it peaks every other year, right?
yeah, but it still has some kind of rhythm, right?
Right, but it's a peak every other year, not every year. And it's based on the idea that it hits children and they're constantly being born, and then there's a level of them that are naive immunologically are
Yes.
naive, and it hits that level in order to see the outbreak every other year, right?
Right, right.
So,
I think that's the main driver.
right,
That
but what I want to know is what makes you think that that level to see an outbreak of immunological naive people is going to occur every year and not every other year or every 5 years
sure,
or
it
every
could.
10 years.
We don't know. I wouldn't say that's herd immunity. I think with a large fraction of the population immune, you will have less serious disease. So you could think about herd immunity to disease, to severe disease maybe, or to death. You can define it if you want.
Well,
All
I
right.
think herd immunity is just you prevent transmission, right? Isn't that the
Well,
traditional definition, is that that the people are
yeah,
immune and they prevent transmission?
yes, but as you know,
So
some
that would be herd
viruses,
immunity.
herd immunity should be preventing transmission. That's right.
So you would have achieved herd immunity. You would just it would just be that every other year 90 that would drop not beyond the 90% when you had an increase of X amount of people who are immunologically naive. You would automatically drop the population, that it would automatically drop the number below 90.
All right, so let's consider the common cold coronaviruses, right? Which most people get infected on a regular basis. So these are transmitting. Most people have antibodies, yet transmission still occurs. So what's the story there?
That's not herd immunity.
So
Herd
there's no herd
immunity,
immunity.
right? That's not herd immunity. Herd immunity is no transmission.
That's right. That's the definition.
So, right. So, if you said that in order to stop transmission, you needed 90% of the population to be vaccinated. So, a better example is measles, right? Measles, you have no transmission in a community when 90% of the community is vaccinated. If I now so I have a community of 100, so 90 of them are vaccinated. If I
Mm-hmm.
now introduce 10 people, I no longer have 90% of the community
Sure, sure.
vaccinated. So my percentage has dropped. And so now I will be open up to infection and
Mm-hmm.
transmission of the disease. So if you said that those 10 people that I introduced into that community are immunologically naive, then I have automatically dropped the population that's immunized or partially
Mm-hmm.
immunized against
Mm-hmm.
COVID. So I am not I am not consistently over 90%. So once 90% is achieved, that's fine. But that's a snapshot because it's not maintained at 90. You have to maintain it. That's the point I'm trying to make.
Yes, I got it.
Right, but I don't think that the U.S. person understands that you hit it, but you have to maintain it.
Sure. That's a good point to emphasize. I read there was a preprint from U.S. scientists saying boys of a certain age had equal chances of hospitalization from vaccine myocarditis versus COVID. I have not seen this. Have you seen this, Amy? So we will have to wait to comment on it. I'm not aware of any
Daniel
such
knows.
thing. He didn't say anything about it today.
Okay. I don't know.
If the vaccine does not stop spread, why in the restaurants in New York City they require a vaccination card? Vaccine is against the severity of symptoms, not against the spread, right? Well, I would say there isn't good evidence that the vaccine does not stop spread, although the CDC says vaccinated people can spread. I'm not sure the evidence.
Well, actually, the
CDC
says that that people who are vaccinated have a reduced probability of transmitting the virus.
Right.
So that's wishy-washy. And so you really can't say that everybody who's vaccinated won't transmit because not everybody who's vaccinated mounts an immune response.
That's right.
Number one, right? So you can't say it's an all or nothing thing. So the best you can say is it is reduced, right? And that has been interpreted to vaccine people can transmit. But that might not be the right interpretation. Right?
Yeah.
And then there are people who, for whatever reason, there are a few vaccines that, I don't know, for whatever reason, maybe they do transmit. But still, once again, it's a very small percentage, right? But it can't be an all or none thing.
I understand. What's the logic in New York then of requiring people in restaurants to be vaccinated?
Is that the vaccine prevents transmission. Is that you are not spreading or you are not infected.
But if everyone's vaccinated.
But not everyone is vaccinated.
But you can't get into a restaurant, right, without being vaccinated.
Right. But unfortunately, even if you are unvaccinated and I think you sit outside, I think you are allowed to go into the restaurant to use the restrooms.
Okay, got it.
I think you just can't sit and eat. I'm not 100% sure, to be honest with you. I would imagine that if you are eating at a restaurant and you needed to use the restroom, that there might be an exception, but don't quote me on that.
If any virus that can correct errors, how does it not correct a variant back to ancestral? Makes me think the variant would have to make multiple appearances before it's acceptable. Well, it probably does, but the variant has an advantage, so the ancestral is never going to appear again. It can't compete with it. I'm sure the ancestrals appear.
Right, but not any virus has the ability to correct mutations. So like the polio polymerase does not have the ability to correct mutations.
But it just randomly can mutate a variant back to the ancestral sequence, though, right?
Well, yes, that's what OPV is, right? It's a variant that mutate that changes back at 472 to you. Okay, it's 850.
So the point is that if you have a variant that has a replication advantage, even if the virus randomly mutates back to the ancestral sequence, the ancestral virus will not be able to compete against the variant. So it won't come back. Okay, I'm just explaining it to John.
Yeah. Oh, yeah.
Three questions?
It's 850, and I have to wash my ELISA.
2 spike proteins walk into a bar. One orders a monoclonal colada, the other a memory cell spritzer. Who dies first?
The memory cell spritzer.
I agree. Good question. How long till we hear it's a pandemic of the double vaccinated? No, we won't hear that. We'll hear it's a pandemic of the unvaccinated, right?
It's always been a pandemic of the unvaccinated.
Amy, is a fever a symptom of an immune response or a symptom of disease? If this question sounds stupid, I apologize.
There's no need to apologize. It's not a stupid question. It's an immune response.
Yes. It's caused by cytokines that increase your body temp. And here's Peter from Northern Highlands. Hey, Peter, I don't know who you were, but cool. That's cool.
Well, how do you even know you graduated the same year?
I didn't assume that. We're alumni. That means we graduated from the same high school.
I know what it means.
What is the downside to boosting 65 and up for prevention of severe disease? I realize the data is best at this point, but it would be tragic to wait and be wrong. Thoughts? Go ahead, Amy.
So technically, biologically speaking, there's no downside. Morally, there's a downside, and stuff. And Ed Young vocalized it on the Andy Slavitt podcast when he was on Monday. Which reminds me, Laurie Garrett was on Wednesday. Did you know that spike is not a? She didn't call it spike. It's what word she used a different word, and it was like, what are you talking about? It's just call it spike. But but it's actually better for us to vaccinate more of the world than to give a booster to the 65-year-old, because it will, at the end of the day, protect us better. If more people are vaccinated and stop transmission, it will protect us better than giving a boost to the 65-year-old, because those people who are unvaccinated still could shed a ton of virus that's a variant.
Listen to tomorrow's TWIV. We're going to have two people on who are modeling sharing vaccines.
Oh, are they the ones? They're the ones from the science paper that I liked, right?
Yes.
The girl from England and someplace else.
McGill in Princeton.
Yeah, and yeah, I remember that.
All right.
But
I've read that breast milk has been found to contain SARS-CoV-2 antibodies. Is there any evidence that it would make a difference for a respiratory virus?
Well, no, it only protects against SARS-CoV-2. But their antibodies, I believe that's how a lot of children are protected against HIV and various other viruses.
I think the question is, if a baby drinks mother's milk with antibodies, will those antibodies make it to the respiratory mucosa? And the answer is yes, right? Mm-hmm. So we know that happens, Mr. Bear Squash You All Flat. Okay, this is maybe the last one because it's funny.
Yeah. Okay.
Amy, what letter grade would you give the following in their handling of COVID pandemic? CDC, FDA, and WHO. CDC?
I take the 5th.
FDA? She's taking the 5th?
I take the 5th. All
right, WHO, we'll take the 5th because someone said we shouldn't be undermining, right?
Well, I'm not undermining. When you look at it from an outsider, you have one perspective. When you're the insider who's making the decisions, you have a different perspective. And I don't have all the information that they would have and know if they've made the right decision or not. Plus, I look at it from a completely pure scientific fashion. I'm not a public health official, and I wasn't trained in public health. So what I think is based on the science, mm-hmm. and a basic science, right? A laboratory science. And I don't factor in other features of public health, which is probably communication and psychology and biases of one group versus another group and various other things. So I probably don't really have the right ability to give them a letter grade, only based on the science, right?
Who would you like to play in a movie about the pandemic, Amy?
Who would you like to play you in a movie? We had this question before, remember? And somebody said, like, Jennifer Gardner, and my sister said, no. And then somebody said, what's her name? The Jewish comedian who's like got crazy hair, who's like in her late 60s or 70s. You know who I'm talking about. She's on the Upper West Side.
Oh, yeah, I know who you mean. It's crazy.
Yeah, what's her name? Can't you Google her? I know you want Christopher Walken to play you.
Christopher Walken. Oh,
Yeah, I
what's her
know.
name? Here she is. Oh
How do
yeah, here
I?
she,
I can't see.
Jenny
What did you?
Slate. Jenny Slate.
No, no, no.
Sarah
She's a
Silverman.
no,
Not Sarah Silverman.
no. It's
Well, that's the one I
older.
was. That's the one I was thinking about. Frances McDormand.
No, hold a second.
I think Steph
Um,
remembers that.
old.
Fran Lebowitz.
Yeah, that's who everybody thinks should play me. I'm not sure. I don't know if she has the neuroses right. She has
Yeah,
different
Fran
neuroses.
Lebowitz.
Yeah, she
Janine
has a.
Garofalo could play you too. No, I want
You
what's
want
his name?
Christopher Walken?
Christopher Walken, so I can talk like this, even though I don't. All
I
right,
don't know. I
Amy.
think you should have. I personally think if you put Christopher Walken up there, then you need like the Darth Vader voice of James Earl Jones.
Yeah, well, it's not me. I'm just a high-pitched Italian from New Jersey. Thank you, Amy.
All right, tomorrow. I forgot now already.
So, well, tomorrow I have a busy morning, but I'll see you in the afternoon.
You have a busy afternoon too.
Thank you.
Three,
Thank you
four
again.
podcasts. All right, I'll see you at some point tomorrow.
Bye bye.
Bye.
Let's see. We could do crop here, but I'm not sure you need to do crop. No, you can't crop when it's just me. Okay. Let's see what we have here. What are your general thoughts or concerns about mu? Julia Roberts. I don't think Amy would like Julia Roberts. I think Fran Lebowitz is the one. The mu is interesting. It has many of the changes of Delta. I think all of them plus one other change in spike. Also has changes elsewhere. In some countries, it's going crazy, right? In others, it's not. I think we have to just wait. I have no idea if that's going to go anywhere. You know how you can find out? You go to covariance.org. This is a cool site. Let me show you. Let's share my screen. So here we go. And you can pick, here's mu down here. We can click on that. And it tells you a little history. It contains some changes. This would be changes, not mutations, because these are amino acid changes. It also has an insertion in the spike. And then down here, mu per country is interesting, right? So here is Colombia, where 70%. So there it's clearly taken over, right? But in other countries, this one is Chile, only 14%. It went up to 33% Curacao. So it's not really going crazy. I don't know if it ever will. So I just don't know. We will have to wait and see. But you can keep asking. That's good. It works for me. I like when people repeat questions. Some people don't like that. So some people here last week said it's not interesting when you get the same questions, but I like them. I like getting the same questions. First of all, it reinforces your learning and it hones my answers. All right, Adam got the Janssen a year ago. Do you need to think about boosters any differently? No, I don't think so. The Janssen, the J&J, works very well against severe disease and death. And only if we see that change, it's being monitored, then you would worry about a booster. But I don't think you should think any differently. No. Do we know how good the memory cell response is after just one Pfizer? So the problem is that most people have got, in the clinical trial at least, the phase 3, where they did very careful studies of the Pfizer and all the vaccines, they gave one dose, they waited so many weeks, and then they gave the second dose. So we didn't let the first dose only go a long time, at least not there. So my feeling is the immune response didn't mature properly until the second dose. Now, if you had let the first dose continue for a while, would it have? I asked Shane Crotty that. He said it probably would have continued to mature to a certain extent, but maybe not the same as a booster. And you know, the breadth of the antibody response, even after 2 shots, is limited, right? But if you if you were to be infected and get one shot, then you have an incredible antibody repertoire. Mr. Harold. Now, Mr. Harold was, wait a minute. Was he the guy? Was he a principal or was he a chemistry teacher? I don't remember. One of those two, Peter. How is research into COVID vaccines in young children? So we think they're going to be licensed for under 12 soon, and then for the very young, under 5 years, is being enrolled right now in clinical trials, and we may know the end of the year, beginning of next year, whether they can be licensed or not. So it's going to be a rough fall, I think, in schools, depending on your state, right? Depending on how they're careful with kids in school. But as Daniel keeps saying, kids are getting more and more infected. Many 200,000 kids a day, and many of them are dying and getting very sick. So we really do need to protect them. As Daniel said today, you look back early in the pandemic, kids weren't getting infected or sick. Yeah, because we were hiding them in the basement. And now that they're out and about, they're getting infected and they're getting sick. So all the things people used to say, oh, kids don't get sick, it's not right. And they develop long COVID too. Mario Della Riva, thank you for your contribution. Grazie mille for giving me hope for humanity since I just learned about your excellent work and content. Salute. Thank you. I appreciate it. It must have come over from Lex Friedman podcast, I'm guessing. The teal blue paint color. It's the wall of the lab, yeah. We didn't have anything to do with that. Yeah, we let the B word slip, yeah. I like to call them infections. I think the B word is not good. I'm starting to think the FDA will limit third to elderly and immunosuppressed. That would be interesting. I don't know. We'll see. We will see. Could use of a saline nasal spray immediately after contact with a contagious person wash away virus? I don't know. It's possible. I think it would have to be more than a spray. I think it'd have to have some kind of inhibitor in it. And it'd be really weird if you passed by a person on the street and then you just whipped out something and started lavaging your nose. I'm not sure that works. You read about an outbreak of COVID among the gorillas. Sorry for the coughing. I remember we had someone from the San Diego Zoo on a while ago talking about her outbreak. So this is going to keep happening unless they immunize their non-human primates, which they did in San Diego. And you can do that because people are starting to visit zoos, right? They're going to infect the animals. Or maybe the handlers are more likely. Yeah, because they're usually glass between the animals and the people, right? Especially non-human primates, yeah. Zhang et al. In their paper in PNAS demonstrate COVID can integrate RNA into the genome. Now, this has been disproven by several other groups. This is really an artifact, does not happen, and as far as I can see, is not biologically relevant. This is very interesting. Related to circadian rhythms, do people experiencing illness have increased deep sleep and or REM sleep cycles? Well, that is a very good question. I bet we know the answer. I don't happen to know it. But if you ask someone who's up on long COVID, I bet they know. I wouldn't be surprised, right? All right, here's one. It doesn't have an at, but I'll answer it because it's a good question. Is super spreading a viral phenomenon or a human behavioral phenomenon? So we say there are super spreader events. where an infected person infects many other people. You know, how many? Abnormally high, 10 or more. But I think here's the other piece of data you need to know. 80% of infections are transmitted by 20% of infected people. So only a fifth of people who are infected transmit infection. We don't know why, but I suspect because they may have more virus in a droplet. That's not been shown. But that could explain why they would be efficient. And at spreading, we did a study from University of Colorado last year on TWIV, or maybe earlier this year. And they were randomly doing cycle thresholds on nasal swabs from students. And they found that, 10 to 20% had most of the viral RNA. It was focused in a few people. So those, I think, are the people that would walk into a bar. So you could make a joke about that. A super spreader walks into a bar. I can't fill it in. You guys can fill it in. Who's going to win over the booster? I think it's going to be a partial thing, right? They're going to say immunocompromised and over a certain age. It's too bad it's a fight, right? Because I think the science is quite clear. I think this is a repeat of your original question. Why, if you're vaccinated, are you protected against variants? It's a different spike than how is the original vaccine effective? Because probably what protects you against severe disease and death, that's what we mean by protection, that's mediated by T cells, where the changes in the variant have no effect on them. The T cells don't care if it's a different spike. They will still do their thing, and that's why the vaccines work. Could we expect that symptoms of a vaccinated person present later on compared to a non-vaccinated person when they get infected? Oh, you mean a slightly slower time course because there are lower viral loads? That's a good question. I don't know the answer, but to me it makes sense, right? But I don't know of any evidence that would suggest that the time course is any different, although probably Daniel would know. It's a good question. Send it to Daniel at microbe.tv, and I will ask him next week. Daniel at microbe.tv. Are there any hybrid vaccines of mRNA and attenuated virus? No, the mRNAs are typically encoding for one or a few proteins, right? So attenuated is an infectious virus. So maybe what you're asking is, could you deliver an RNA that would initiate an infectious cycle, right? And there are some vaccines like that are experimental. I think self-amplifying vaccines, you put the RNA and they initiate a cycle. So I think there might be some out there. Is there a risk that mRNA vaccines induce an unintended reprogramming? I haven't seen any evidence for that. There was a paper out earlier. It was a preprint, right, that suggested that. But I have not seen the paper. It's possibly failed in review or something. So let's reserve judgment till we see it. All right, so Mike says, you mentioned last stream a vaccinated person who's infected doesn't shed. Does that mean they won't transmit and are safe to be around? So as you heard Amy say earlier, it's not black and white. I was incorrect to say that. Some people will shed. It depends on how well the vaccine works in you, right? Because when you vaccinate a population, you always get a heterogeneous vaccine response. So some people will shed, but it'll probably be a very low percentage compared to unvaccinated people, and what they shed will be less. So there might be some transmission, but nowhere near as much as with unvaccinated people. But I would say if you are all vaccinated in a group, you're okay to be around each other, because even if someone sheds and they infect you, you're going to get just mild disease. Thank you, Andrea, for your contribution to the incubator. It's really appreciated. In TWIV 802, Garrett writes, Shane Crotty said that a natural infection followed by a vaccine resulted in hybrid immunity. I just got a text from Theodora Hatsuanu. She said, what is this hybrid immunity? I don't like it. So it's really good. If you recover from infection, you get one vaccine dose. You get really broadly neutralizing antibodies that handle any variant. Is the same when it's reversed? I asked him that. He seemed to imply that there were some data for that. I haven't seen them yet, but he said yes. But if, there will be, because people are looking at it. It's a really important question, right? Thank you. Can you and Amy discuss the paper on TWIV 805? So Amy's gone, but I think we discussed it briefly up front. I mean, the idea is these are cell culture experiments, and they provide some insight, but they don't prove that Delta will move through a population quicker because of intrinsic properties in the virus. So we need more data on that. I think it shows why Delta is more fit. It reproduces better, at least in respiratory cultured cells. But whether that plays into transmission, the movement in a population, we don't know. Public Health England has a new estimate for long COVID incidence of 1.6%, much lower than earlier. As we move further out, you have to define how long. It's a certain number of weeks, right? But what if it goes away after 6 months? That's long, but it's not chronic, right? So it seems to me that it's different. I think the number is going to be changing as we study it. And, every week it seems there are new studies that address this. So I really don't know what that means. What other pods do I listen to? Well, now that I have a short train commute, I don't listen to too many. So here's what's on my podcast player. I use Overcast, Accidental Tech Podcast, ATP, Bioinformatics Chat, Cyberwire Daily, Darknet Diaries, Exponent, In Defense of Plants, Intelligence Matters, Lawfare Podcast, Lex Friedman, Pod Save America, Security Now, The Taproot, and then This Week in Tech, and of course all my pods. I don't have to listen to them because I listen to them over and over again. Well, look at this. My daughter just sent me a picture of a vaccine card for the polio vaccine. Not hers. She probably picked it up at a flea market. Look at that. It's got the dates. It's 1956. So this would be the first inactivated. First dose, 7/18. Second dose, 8/1. Booster dose, 1957, February. Wow, how cool is that? Very nice. I'll have to say, very cool. Vaccine cards. So that's my pods. I did an AMA yesterday. Someone asked me, what are your 5 favorite films, your 5 favorite albums, your favorite cheese, your favorite wine, and your favorite cuisine? Whoa, that took a long time to answer. What's the difference between Pfizer that has the EUA and now fully approved? There's no difference. It's the same vaccine. It just has a different name, but it's the same components. Shane Crowdy was on Wachter's Grand Rounds. Everybody's getting into the Communication Act. I don't know. Not all of them. I think Wachter makes a lot of mistakes, frankly. I heard him talk the other night, and he really made me cringe. He's the head of medicine at UCSF. He has a big platform. He ought to be careful about what he says. Vaccine immunity is waning. What do you mean? Against what? Yeah, the antibodies in serum go down, but you're still protected against severe disease and death. Is that waning? No. Come on, Bob. My hospital worker friend saw plenty of obese patients with hypertension and diabetes not suffer severe disease. Well, nothing is black and white in biology and medicine. You know, obesity and hypertension and diabetes are comorbidities which can make other diseases worse. We know this, but it doesn't happen 100% of the time. There are people who escape it for whatever reason. We don't know why. And the reverse, perfectly healthy people seem to get severe illness. We don't know why. We're working on it. Stay tuned. Keep listening. You'll find out. Any merit to the claim that monoclonals increase the risk of generating new mutations by selective pressure? Any antibody will exert pressure to select a variant. It's not going to make the virus make new mutations. The virus makes mutations independent of any drug or vaccine or immune response. It's an inherent property of the virus, the mutation rate. What the selection does is to pull out specific variants that do better in the presence of the selection. So, if you have antibodies due to infection, vaccination, monoclonal therapy, they have the potential to select variants from you that evade them and will multiply better. So it's not just the monoclonal, it's any immunity. Yeah, I know karate was hard. Next time I'm going to send him a headset. I don't know why people who aren't on shows regularly don't get better equipment. I mean, when I go on a show, people go, "Oh my God, this is the best I've ever seen." And it's not for them. It's just because I want to have good sound quality, right? But you would think. But you saw that, what's her name? The last lady on Friday's TWIV. Something Breitbart. I hate to say just Breitbart, right? I have to find out her name. Oh my God. My host, and I don't know what her name is. Maya. Shame on me. She had a headset. Isn't that great? You're still waiting for ivermectin. Well, the big trial is underway. You've got a many thousand people trial. We're going to find out what happens for sure. Whatever the answer is, we'll accept it if the study's done properly. I'm sure it is. It's run by NIH. Can viruses still mutate in fully vaxxed people? Wherever a virus can reproduce, it can mutate. Okay? If it's reproducing in a cell, it's getting in a cell, and more viruses are being made, even one cell, it's going to mutate. Yes. Is there any way to promote IgA? That is a great question. And, there are some vaccines that are really good at inducing IgA and, more importantly, memory. But we don't know why. People have tried to figure it out for years. No clue. You thought Dex was taken for the storm. Well, dexamethasone is taken at a certain point later in infection, after the viral phase is almost over. Okay, it's an immunosuppressive. You don't want to give it during active viral replication because then the virus will reproduce even more. So you give later if people then have high oxygen low oxygen in their blood, and they're having a cytokine storm that's damaging their lungs. So then you give them Dex to suppress the storm. But you don't want to take steroids to prevent the storm. You're only going to take it to resolve it once the viral phase is over. Really important. It's a good joke about spike proteins. How does CCR5 stem cell bone marrow transplants work as treatment for HIV? So what you do is you take a person who... So it's been done with people... the first guy was the German patient. He had leukemia and HIV/AIDS. So they gave him a bone marrow transplant. So you ablate the bone marrow, and then in his case, he got a transplant from a donor that matched him, who was also CCR5 null. He had a mutation in the CCR5 gene that prevented its production, and therefore the cells, all of these cells, so the bone marrow contains the precursors to all the immune cells. All the cells produced by the German patient's new bone marrow have no co-receptors for HIV, so he was virus-free. The problem is a bone marrow transplant is very expensive, and it has a very high possibility of killing you. So that's not a cure for HIV/AIDS. However, you could knock out the CCR5 gene with CRISPR-Cas, so that's one approach that could be looked at. She'll be worried about the Nipah outbreak in India. I don't think so. These have come and gone over and over, and the virus, once it infects people, it does not spread very well. It's kind of like Ebola, and it eventually fizzles out, and this has happened countless times. I don't think we should worry. I think there are other things to worry about, but I think we should be vigilant and watch out. Whenever there is a case or two, we should make sure we watch it and make sure they're isolated so they can't spread. My son hunts deer every year. He dresses butchers and eats the venison from his take. Should he skip it this year with deer being infected? I would say if he's vaccinated and careful, he would be okay. And wear a mask while dressing. Just be careful. I'm not sure he needs to skip it. I mean, we don't know if the deer are infected where he is. We don't know if they have a high enough virus load in them. But, we don't know where the virus is in deer, but it's most likely in the respiratory tract, right? So if you're just taking mussels and being careful, it's probably all right. Rochelle Lewinsky's job is herding 350 million cats. It's a tough job. I agree. But I think you have to be science-driven. Study from Israel, I don't know which one, but let me say something that these are observational studies which are tricky. We talked about that on the last TWIV. There can be confounding factors that you don't pick up. And so there's some noise that some of these studies out of Israel have mistakes in them. So let's wait till they get peer-reviewed, and hopefully they'll be picked up. COVID vaccines have a S protein tied up in prefusion state. Does that block other entry pathways? Well, I'm not sure. I think it doesn't completely block binding. It's going to reduce it because you can still bind in the prefusion state. It's just not as efficient. The cleavage is what mediates fusion, not just binding. Is anyone, by the way, someone asked later, were you able to free up your money from YouTube? No, I haven't been. Every time I go and try and put my bank account information in, it says, we're sorry, your attempt failed. Please try again. And I try over and over and it doesn't work. I try multiple bank accounts. I know someone pretty high up at Google. I asked him for help. He ignored me. So if anyone knows someone that, this is, what is it? It's the advertising arm of Google. I'd really like to get that money out of there. It's crazy. Is anyone studying vaccine-induced high-affinity antibodies against spike versus antibodies against spike plus N plus M from natural infection attenuated vaccine in the Elter? Well, that's a very specific problem, right? And here in the U.S., we only have spike, pretty much, vaccines, right? The other antibodies would be induced by vaccines given elsewhere, and so maybe they're doing those studies in other countries, but there are a lot of other vaccines out there that are not studies as well, and so I don't know this particular question in particular. I have to take this drug every Gazinutuzumab, Gazyva, Gazyva, which is it's a humanized antibody, yeah, and it is anti-CD20, and CD20 is expressed on the surface of B cells. So now we can figure out that you may have a problem making antibodies, right? Because this is suppressing B cells. Because that treatment is to get rid of B cells for other diseases you probably have. So I think that would impair your antibody response. You might want to get it checked to see. You can get an antibody test for sure, and you get a number back so you can tell if you have antibodies or not. Over several Q&As, you tell people to wear a mask. You wouldn't wear a mask in your BSL-3. Suggestion. Well, your surgeons wear masks, right? Next time you have surgery, tell them to take it off if you don't think they work. Of course they work. They're not 100%, but there's a good study out that Daniel mentioned in the last clinical report. Check it out. I think it's one of the better new masking studies. No, for a BSL-3, you have a PAPR, right, an enclosed ventilator thing on you, but everybody can't wear those, right? So you have to have a trade-off. Everyone can't wear a PAPR out on the street. It's just not practical. So Daniel actually demonstrated a bunch of masks. You know, some of them fit really well and they're good. They're not going to be 100%, but they're better than no mask. So wear a mask. I'm a structural biologist. I'm writing my first virology paper, NSP3. Yeah, send it. Vincent at microbe.tv. We'd love to look at it. Do you know if there's any head-to-head study comparing intravenous IG with monoclonals? As in kids, we give IVIG and it works. I'm not aware. Not aware of that at all. Head-to-head, no. Nope. If I get infected after vaccination, will the antibodies memorized and generated during the actual infection dominate over the ones memorized due to vaccination? No, the main ones are going to be the ones you generate after your first encounter, and those will have matured extensively, and then you'll get a boost from the infection, which we hope will broaden the repertoire. We hope, because it hasn't been completely studied, but that's the idea. The masking studies for CDC were not good, but there is one that Daniel talked about today. And let's see if I can find it. I think that was 806 today. And I'll show it to you. Okay, so here's the study. It's a CDC study. Let's share my screen so you can see this. SARS-CoV-2 transmission to masked and unmasked close contacts of university students. Okay, so, they had these kids with and without masks. Each compared with only masked exposure, the close contacts with any unmasked exposure had higher adjusted odds of a positive test. Each additional exposure was associated with a 40% increase in odds of a positive test. So I think that's a pretty good study. You should check it out. And I think it's not 100%, right? It's never going to be. Nothing's 100% in life except dying. All right. Malone said that if you have high population of vaccinations, there's a risk of a super variant be created. Where does this come from? We never had this happen. We've used a lot of vaccines against a lot of viruses. We don't get super variants. We got variants. So the flu vaccines are a good example. We get variants, but they're not. I don't know what a super variant is. And as I said, the T cell sites don't change anyway. So Malone is not thinking about T cells, which protect you from death and severe disease. They don't change those epitopes. So this is not really making any sense. Estimate of PASC, 0.5% of what? 0.5% of what? But the studies that Daniel quotes of, recovery are much higher. What fraction of people go on to have continuous symptoms? It's more like 20%. So I don't know, 0.5, I'm not sure what your denominator is there. It must be different, right? Now we're getting to the Nicki Minaj. Let's see. I mean, she has, no matter what you think of her, she has a big following. So you don't have to pay attention, but you have to understand she can influence a lot of people. So we want to know how to fix that. That's the thing. Is SARS-CoV-2 truly aerosolized? So I presume you mean by aerosol the finest droplets that travel very far. I think in certain situations, yes, it could be, but I don't think it's the norm. But I'm willing to look at new data. Yes, this is an interesting question. How many people would get smallpox vaccine if there was an outbreak? I think many more than have gotten the COVID vaccines, right? Yeah. Now, why would that be? Smallpox has a history that a lot of people know, that it disfigures you, right? 30% death. 30% of cases go to death. So, yeah, I think you're right. Most people would get the smallpox vaccine. And you bet. Following from Lex's question, could there be a highly transmissible lethal virus which has some properties of HIV? Transmitting people could be walking around for years without symptoms. So it is HIV, right? You have no symptoms, but actually you're not absent of symptoms. Most people do have some symptoms in the acute phase, and in the long period of low viral replication, they do have symptoms. And then, depending on how quickly your infection is proceeding, you get AIDS and you die of opportunistic infections, of course, unless you're taking drugs. Could another virus like that arise, but be highly transmissible? So for HIV, you need blood or sex, right? So that's not highly transmissible because you can't get it by just walking by someone on the street. Could that happen? Sure. But I think if it were highly lethal, depending on whether they're shedding during the pre-symptomatic period or not, that would determine whether it would transmit well. Because with Ebola infections, you don't transmit before you have clinical disease. So, you can be infected and walking around, but you're not transmitting it. But then you get sick and boom, you go in the hospital. So we can reduce the transmission there. But if Ebola patients were shedding before, that would be tough. Then that virus would spread really well, but it doesn't. So SARS-CoV-2 has a pre-symptomatic period where it transmits, right? And that's why it's difficult to contain. SARS-CoV-1 didn't have that pre-symptomatic shedding phase. Your peak of shedding was when the peak of disease occurred and you were usually in the hospital. So all this is to say that I don't see why it couldn't happen, but we haven't seen it yet. But that's probably not a reason for it not to happen. But I just hope we're ready for it, right? We should be ready. How does the body clear an HPV infection? Well, there are all kinds of papillomaviruses, right? They can cause warts all over the place on your hands, your body, your feet, right? And so they reproduce in the not the most outermost layer of skin, but the underlying living cells. That's where the virus particles mature. And then as your skin falls off, the virus falls off with it, and that's how they're transmitted. So they're usually restricted to where the wart is. And if the wart is cut off or laser treated, whatever, then that's it. It's gone. But your body does control many papillomavirus infections as well, probably by immunity. if we need an updated vaccine in the future to handle a new variant that has significant immune escape, would OAS interfere? I don't think so. I think that the experience with people who are infected and recover and then get a vaccine boost tells us that all we do is we expand the antibody repertoire to encompass more variants. So I don't think OAS is an issue with COVID vaccines. Britt Glounsinger was on TWIV some time ago. It was a live event. I went to Berkeley and I sat with her in the front of an audience with Eva Harris. So I put mics on them so the sound was good. So you should check that out. But I don't know why I would have her again. Of course, she's done some interesting work, but spikes do not cause prions. No, a prion is a misfolded protein. So if you ingest material contaminated with prions, human prions cause human neurological degenerative diseases, then those prions will get in you and cause your proteins to misfold, the same protein as the prion protein. And there's only one that we know of for people. And so the spike protein doesn't do that at all. There's no evidence for it. Some people have suggested it does, but there's no basis for that. There's no evidence at all. You know, you could suggest anything happens, but if you don't have evidence for it, there's no point. But a lot of people can't distinguish, right? So rumors spread. So the vaccine mRNA stays in the cytoplasm, but things happen in cells, right? A little bit of our mRNA could get into the nucleus for sure. And it could be reverse transcribed, sure, because cells have reverse transcriptase. But I don't see any evidence of it, so I'm not worried about it until I see the evidence. Could you discuss in the future how certain HLA alleles play a role in fighting off viruses? Yeah, we could. So, yeah, that's right. B57 HLA has a protective role. People with, what do they call elite controllers who have HIV infection for years, but they don't develop AIDS. A lot of them have B57. We think it enables the T cells to recognize infected cells even when the peptides change. Now, if you're astute, if you're listening to me, I just said that a T cell epitope can change. Right? You're going to call me out. You should call me out. But Professor, you said T cell epitopes don't change. They don't change for SARS-CoV-2 because if it changed in me, if a T cell epitope of SARS-CoV-2 changed in me and then I transmitted the virus to you, it wouldn't matter because my HLA is different and the same T cell epitope is not going to work in your HLA molecule. But for HIV, you have an infection for years, so the T cell epitopes can change within you and that can make things worse for you, right? So then T cells can't recognize your own infected cells. So it's the difference between the T cell epitopes changing in a single host over a long period versus multiple hosts. So for multiple hosts, it doesn't work. So people with elite controllers who never develop AIDS, they have HLAs that can recognize the mutated or the changed T cell epitopes in the viral proteins. They're good at that. That's why they can clear the infection. Isn't that great? It's great. What are your thoughts on Novavax? Well, we went over the data. I think we went over the phase 3, if not at least the phase 2, and it looked good. So preliminary protection looked really good. We're waiting for the final report. We don't have it yet. I think it looked good. I think the protein vaccine had good induction of immunity. We don't know how long it lasts. Hopefully it will be licensed at some point, right? Or not licensed, but given an EUA. So I'm bullish on the protein vaccine. Any point in getting vaccinated after having COVID? Absolutely. As we have said many times, people who are infected and recover and get one dose of vaccine, they have the best immunity of anyone on the planet, anybody on the planet. So one dose is all you need, and you can handle any variant. So I would do it just for that reason alone. Nasal vaccines, early development, too early yet. Not sure. I mean, we're going to need a vaccine for a while, so maybe they have a chance of coming out. I got Moderna and Amy got Pfizer. What are your thoughts about vaccine immunity compared to infection? So I asked this of Shane Crotty, and he said they're very similar in terms of breadth and durability, longevity, but the natural infection immunity is more heterogeneous in people. What that means is you get a wider range of responses. Some people respond really well, some don't at all, and then in between. Much more heterogeneous than a vaccine-induced response. So that's why, if you recover from COVID, we say get vaccinated, because we don't know where you fall in the spectrum of crappy response to really good response, right? Thank you, Ditching, for your contribution to the incubator. The link to the Lancet article from the last TWIV is broken. Oh my God. So you're talking about TWIV 805? Well, thank you. I appreciate it. Let's see. Lancet, the vaccine boosters. Yeah, it works. Mine worked. You get it's to the PDF, and they don't want you to. So I probably put my PDF link from my university, and they don't want you to have that, right? So here's what I get when I go to that. So here's the TWIV show notes, right? And here's the Lancet paper. Click on it. Go to this. So let's see if we go there, copy that, and we paste it in. Hey, look at that. Now that's broken. It's not my link, though. I'll fix it. No worries. Thank you for pointing it out. I always appreciate it when people point. I always break things because I have too much. I do all this myself and I make mistakes, right? So even if they're 0.1%, I do so much that they stick out. Yes, Ian. T cells do get exhausted, especially in these chronic diseases where the virus is around for a long time, like hepatitis B. Yeah, they get exhausted, they stop killing, and you have to reanimate them with like CAR T cell therapy or checkpoint inhibitors that reverse the exhaustion. Yeah. Look at this question. This is like a question from the beginning of the pandemic. It's great. Does a positive PCR in a vaccinated person mean they're infected? I would say it really depends on this cycle threshold, right? Because it could be very early in infection. It could be at the end of an infection, so they would be low cycle thresholds. They could be. But how they're infected, you have to remember there was a study out of Singapore that looked at frequent testing of people vaccinated or unvaccinated who were infected. And for the unvaccinated, the PCR CT stays constant for a long time. And for the vaccinated, it declines very quickly. So you may be at the end of the infection. It ends very quickly. So it could mean that, yes. If a vaccine causes fever, the fever can cause tinnitus. Thank you. Thank you very much. I look tired? Really? I'm sorry. Have a drink of water. I don't sleep well. I have too much to do. I had 3 pots a day, and you have to prepare for them. So I worry about them the night before. Tomorrow I have 3. And 2 early in the morning because they're in Europe, people in Europe for a European meeting where I have a bunch of people from the meeting, including the lady who developed the ChAdOx1 vaccine, Sarah Gilbert. and others, Florian Kramer, people from Italy, Denmark, Netherlands, Wales. I have to prepare for that. But I worry about it too, so I don't sleep well. And then I have TWIV in the afternoon. We have guests also. I have to prepare for that. Having guests is stressful because you have to draw them out. It's not like chatting. That's easy. Then Friday night I have to edit Daniel's TWIV, which we recorded today. Saturday morning it's released at midnight. Then Saturday I have to edit the regular TWIV for release on Sunday. So that's why I'm tired. I don't mean to make excuses. I love what I'm doing, but I'm tired. I would like to get a good night's sleep one of these days. Now we're talking about tinnitus. This is an interesting comment I saw earlier on the YouTube. I feel this is very important. You get only 500 plus viewers. Is it really a pandemic out there? It looks like no one gives it a frack. Yeah, they're not ignorant, but they're just not interested in long, complicated science. I get it. We have 652 people right now, so we're not going to break 700. I think that's fine. As someone told me before, the people who are here are interested. So I think that, and you guys will spread the information, so I think it has a bigger reach than we think about. No, Malone didn't invent the mRNA vaccine. It was Kieran Carrico, whatever her name is, and the guy, the two people at UPenn. He stated the vaccine should only be targeted for vulnerable people. No, that's not true at all. This is completely contrary to the historical use of vaccines, which have been very successful in extending our lifespan. So this is wrong. Sorry. Prions, no. HIV, CCR5, we did that. Fever. I know your focus is quite a bit on the U.S. Have you taken notice of Alberta? Yeah, my wife's family is from Alberta. But what would you like me to notice? I try and pay attention to the world, contrary to what you may think. But maybe it is not obvious. Thank you, Clint, for your contribution. Really appreciate it. My wife gave me the Right Amy t-shirt. That's great. Right, Amy? Very good. Very good. When virus mutates in a previous vaccine, reduces the affinity and avidity, can it be a risk? They would have to be completely non-neutralizing. Because then when the antibody bound to the virus got taken up into, say, an FC receptor expressing cell like a macrophage, then the virus would have to get into those cells and reproduce. So far that hasn't happened because remember, your serum is a mixture of many antibodies directed against different parts. So even if one antibody against one part doesn't work, the others still work. So not happening. I haven't seen any evidence for that. Some repeated. How can we end aging and stop cancer? You can't. Impossible. Some people think they can. They can make drugs to stop aging. But then the reason we get cancers is because we live too long. Because if you die at your 30s, mostly you don't get cancers, except some childhood cancers. But you can't stop aging. Biologically impossible. Now, you could say I'm wrong. That's fine. It's just my opinion. The university classes are packed. We wear masks. The uni is trying to set up rapid testing. What other measures can I take? Well, you're doing the right thing. You're wearing a mask. And you need to have rapid testing instituted. Those are the two best things you can do. Thank you, Dan, for your contribution. Really appreciate it. The spike protein joke keeps appearing. That's really good. Can you make predictions about the upcoming flu season? I can't. I think it's going to be bad because not many people had flu last year. But I'm going to ask Florian Kramer tomorrow that question. So listen next week when I release it. We are still at early comments. Any comments on the Israeli data? So again, these are observational studies. They have to be careful. So they're under peer review. I really prefer to get them peer reviewed before we comment on them. What's your vitamin D level? I don't know, but I take recommended daily dose every day, for sure. Masks don't prevent you from inhaling particles because particles are not spreading. Their particles are within droplets, which are hung up in the mask. Yeah, for sure. Would the proofreading exo be a wise target? Yeah, and people are targeting that for antivirals, for sure. Absolutely. Can't Australia be considered an animal transmission experiment? Why could Australia control the ancestral strain? Lockdown, right? Lockdown works. It did it in India. And then when they came out of lockdown, Delta took off. But lockdown works. And you come out of it, people get together, then you get transmission. But you can't use that OzCam to prove that whatever happened was... So just saying that we controlled it, therefore it was less transmissible, that's not how science works. It's not how we do that. And, human experiments are not controlled. That's the way we get good data. How many hours a day does she spend? "12 hours a day, 7 days a week." Why does she do that? She loves it, and she wants her own lab someday, and she needs to work hard to get it. Mutation rate for SARS-CoV-2. You want to know the number of base changes per nucleotide per replication cycle. So I don't know the number offhand, but as Amy said earlier, it's about one base change per genome. So every time the genome reproduces, there's one base change. So you can calculate 1 out of 30,000. But in an infected cell, there's certainly more than 30,000 genomes made, so you can have every base changed in one infected cell as the virus reproduces, right? That's incredible. And other RNA viruses are higher. The reason the coronaviruses have a lower rate is because they have the proofreading exonuclease. Is a single drug going to be quickly useless? Yes, I predict so. That's why I think there are at least 3 approaching EUA, and we need to use them in combination. If we start using them singly, I guarantee we're going to get resistance. It's going to be a disaster. Then we can't use them. You heard it here, right? Has there been a study on HLA and SARS-CoV-2? I don't know. It's a good question. There have been genomic studies trying to sort out, genes that predispose to serious COVID, but I don't remember. Amy would remember if it would be here, if she were here. Yeah, I don't remember. Let's see. How does variola pronounced? So I used to pronounce it variola, right? And then, what's his name? The pox guy who's Rich Condit's friend. I can't remember his name. For God's sakes, I heard him say variola. And he's a pox virologist, right? So I figure he knows what he's talking about. Grant McFadden. Now, he's Canadian, so maybe he says it funny. It's a joke. I like Canadians. I like all people. So variola or variola? I'm not a good pronouncer. Not a good pronouncer. Adam gets annoyed when we spend too much time on dumb questions. Adam, there are no dumb questions in my view. I think that makes me a better teacher. That's what people have told me. Let's look for some super chats before we wrap this up. Vivian, thank you so much for your contribution. It's really appreciated. Let's see who else is down here. We have lots of great questions. As I said, at some point I'll go longer. Not this week, though. I have a few things to do tonight. Thank you, Dan, for your contribution. Respectfully disagree with your statement on Lex. There's no other life in the universe. Yeah, you can disagree. We'll never know, right? It might be teeming, but I don't think so. I think the Earth's emergence was a rare thing. But, we can both be right because there's no evidence either way. Because you say, I think, and I said, I think too. No evidence, right? Josh, thank you for your contribution. Several papers suggest infection-induced immunity is sufficient. Some say it's better than vaccine. Well, it's variable. That's the thing. That's what Shane Crotty said. So in some people it's better, in some people it's worse. It's more heterogeneous than after vaccination. And as I said, if you get one vaccine dose after recovering, you have the best immunity on the planet. You will be resistant to all variants that arise. So why wouldn't you want that? It's your choice, Josh. I'm just telling you the facts. How about some more thank yous? A lot of great questions here. I'm sorry I never get to them every week. I watch a lot of other streams. They have way fewer people, and they actually finish all the questions by the end. And I'm always like, how do they do that? Well, there's only 20 people in the chat. Thank you, Ralph, for your contributions. We're always based on the science. We spice it with with our opinions now and then, but we try and make those based on science. And I appreciate that you appreciate it. I'm scrolling like crazy through these questions. What happened to the SARS-CoV-1 vaccine study? This is Joseph. I just happened to see next to a super chat. Never got going. Didn't get out of animals. Didn't get out of preclinical studies. And the infection ended, and that was it. No more impetus. Thank you, Sandy, for your... Oh, that's a wonderful quote. Those that can do science, those that cannot support the incubator. I appreciate it. We're going to do good things in the incubator because it's going to be more than just me, for which can only be better. Thank you, Mr. Ozzy Can. You're not a pest. You're just a little persistent, which is good. But I respect everyone's opinion. That's reasonable. I understand where you're coming from, but it's fine. Thank you for your support. I'm sorry I didn't meet you when I went to Australia many, many years ago. I don't know, 5-6 years ago. It was a lot of fun. Someday I'll go back. This is the third time I've heard about prions and spikes. So there's something going around, like everything else. Someone starts a rumor, the spike can cause prions, and then people don't know what that is. It sounds serious, so they get crazy. And I say on my live stream and on Twiv, it's nothing, and I say why, but hardly anyone hears us. We don't have any penetration. The really good penetration we got lately was Lex Friedman. So thank you for suggesting me. And it shows me that those kinds of appearances are important, where you have a lot of people listen, and then you get a fraction of those coming over and listening. Yep. I've been diagnosed with COVID on the 14th. What do you suggest I do? Well, live a healthy life. Get good sleep, eat well, stay away from people, and in 10 days you're done. And if that's your first encounter, if you weren't vaccinated, get a boost, get a single shot of vaccine, and you're golden. You're golden. An old saying, you're golden, right? Thank you, Thomas, for your contribution. Really appreciate it. The link is missing the final T, really? Well, let's see if I put that in, because that's something that happens, yeah. Well, there's a text. Yeah, it wasn't missing it here. Anyway, I'll check it out, don't worry. Sorry to distracted. Is the viral mutation rate dependent on the number of vaccinated people? No. What's selected the more mutants out there, the easier it is to be selected. But the fundamental mutation rate is independent of how many people are infected, right? Someone else answered that. Got a lot of knowledgeable people here. The Thursday night is a one-time thing. Yes. I had to go to dinner last night with my wife and a guest, so I had to do that, and that's why. But normally I don't cancel this. So this is a one-off. Next week we'll be back on Wednesday, and I'm very sorry. And I know that we lost 100 people or so, but that's fine. I can't even get through your questions, right? But you should check out the Livestream Virology course, which is happening at the end of this month. Yeah, I think you'll enjoy it. It'll be fun. Thank you, John, for your contribution. Why is spike sufficient? So that's because, the spike is on the outside of the particle, right? Let me get my virus. All right, so here's a SARS-CoV-2 virus particle. There's the RNA inside, but we don't want to concern ourselves with that. So here's the particle, and these are all spikes in red, right? So antibodies, like this is an antibody. Isn't that cool? They made it with a magnet. This binds the spike. Spike, of course, attaches to the cell. So if you have an antibody here, it's going to block attachment. So that's why these are sufficient to block the virus from attaching antibodies to the spike. Now, it could be that there are other viral proteins here. You see there are white ones and blue ones embedded in the membrane. There's a blue one, right? And here's a white one here. It could be that antibodies to them would also inhibit attachment, maybe sterically, but I'm not sure if that's been looked at. But so antibodies to spike will block attachment. And so if you made an antibody to a protein, there is a protein coding this RNA. And if you made an antibody to that protein, the N protein, nucleocapsid protein, it would not block attachment, right? Because it's inside the particle. There's no way that first the antibody could access it, and it's just not involved in attachment. So that's why the spike antibodies work well. And that's why most of the vaccines were based on spike, because these are going to block attachment. Thank you, Richard, for your contribution. Why the discrepancy? So herd immunity number is based on the reproductive index, R0, which is determined early in an outbreak before there's population immunity, before there are any interventions of any kind. It's thought to represent the intrinsic transmissibility of the virus, but it's a squishy number, and you can imagine it can vary depending on where it's calculated. So that was calculated early in China as between 2 and 3, which would, if you use the formula, 1 over 1 minus R0, it gives you 60 to 70%. You need herd immunity to stop transmission, to bring the R0 below 1. Some people think that the variants have a higher RE or RT. You can't do R0 once a pandemic begins. You have to do RE or RT, which are estimates, because interventions can change the transmissibility, right? And so some people think it's higher, and that's why you get 90%. That's the reason. So Amy said 90%. I guess she thinks that's the one. That's fine. Thank you, Caroline. PhD student, currently math model alpha virus replication. My background is only comp sci, but have a virologist on my committee. Advice for what? What do you want to know? Vincent at microbe.tv. Be more specific and I'll help you out. If mRNA vaccines, you see, I can't stop answering questions. If mRNA vaccines enter cells without needing a receptor, why do viruses rely on receptors to enter cells? The mRNA vaccines are made of lipid particles that naturally can get into cells. That they were designed to do that, where the viruses can't do that. They're too large and they need to attach to a receptor to get into cells. Okay, let's go to the bottom here and see. I guess we should wrap this up for tonight. Yep, here we go. That'll do it, folks, for this Thursday night special edition of this live stream. 337 likes, not bad. If you haven't done so before you go, please give it a like. Come back. I'm sorry if your question wasn't answered. It's not personal. It's just couldn't get to them all. They're great questions. Bring them back next week. And in the meantime, oh, look, there's a Rutgers scientist who says you're a cult leader. I know, that's Richard E. Bright. That's baloney, because a cult leader is misleading everyone. And that's not nice of him to say that, because I'm a Columbia scientist. I'm also a professor, as he is, and he's showing great disrespect. Fine. And you guys, you're my cult following in the sense that you're getting good information from me. You follow Amy and my cult here and the Twiv cult for sure. Anyway, that's that, and have a good evening, folks. Stay safe and see you next week.